Welcome to Behind the Buzz. My name is Rebecca Urena, and we are here with Matthew Jones from Dyadic. Thank you for being here.
Thanks, Rebecca.
Of course. So tell us a little bit more about the company and for those viewers who have no idea.
So Dyadic is a company based in Florida, but has European operations, really laboratories, where we are perfecting the cell line called C1, which is a platform that Dyadic has been using for many, many years. Previously in the industrial enzyme setting, where we manufactured a lot of enzymes for firms like Avinger, BP, Shell, DuPont, BASF. And in that world, we were making a lot of enzymes very cheaply. So these very, very large tanks, things like biofuels, biofeeds. We sold that business about 3.5 years ago for $75 million. And we have retained the rights to drive C1 even further, but focusing on human and animal health. And we're the only party that can sub-license. So we're now getting busy about talking to the world's biggest pharmaceutical companies around expressing their genes of interest. So moving from enzymes to therapeutics.
Wow, okay. And so what's new with the company?
Well, I guess so in a way then, we're about 3.5 years old, right, in terms of therapeutics. And I think what that means is that we've learned how to take this workhorse cell line, a cell line which is very productive, very quick, very cheap, at making lots of stuff. And we've tweaked all the engineering inside the cell to be more focused at being relevant for big firms like Sanofi, which we announced last year. So big pharmaceutical companies are looking to express their genes of interest, vaccines, MABs, those sorts of things. So we've announced that. We've also announced animal health campaigns as well. So basically we're agnostic to who the patient might be, a cat, a dog, a cow, or a human being.
Okay.
So Dyadic has many applications that C1 can be used for.
Wow, okay. So you're looking to expand the healthcare system?
I think we're looking to disrupt it slightly, actually. So if you think about sort of Dyadic as a stock, we are not a biotech that has binary deals in our pipeline. We're not developing our own drugs. The drugs will be owned by, or are owned by, our collaborators, our partners, Big Pharma, for example.
Okay.
What we are busy doing is making sure that we have the most robust, most highly expressing cell line. So lots of proteins can be made out of our cells which secrete, and therefore we lower the cost of goods. And disruption will come, we think, because we can actually make drugs a lot cheaper than they are currently.
That's great news for a lot of people. Tell me a little bit more about the coronavirus outbreak and everything related to that.
Well, it's quite timely. This morning we were interviewed at NASDAQ on this topic because it's obviously pandemics or epidemics are going to become much more regular, I think, in the next sort of 50 years. There's more of us on this planet living longer and in some quite dense populations, and so it's inevitable that disease will spread quickly when it comes. I think what's going to change though is the way in which as a society we have enabled ourselves to rapidly deploy, say, vaccine technology or for prevention, and of course MABs or other sorts of biologics for cures. C1, our platform, competes against E. coli or CHO, both in terms of cost and in terms of time, but also in terms of availability. You know, we are a biotech company. There's no crazy licensing or royalty stack issues here. We haven't signed any deals exclusively. We're looking to support healthcare by being able to deploy vaccines, make vaccines very quickly, very cheaply. So the coronavirus is now the next big outbreak everyone's, of course, very concerned about. And I think that apart from quarantines being improved now in society, what's missing is rapid, cheap, cost-effective, affordable healthcare, both in terms of the back end, in terms of cures, but in terms of vaccines being made prevention. And so the work we did with Sanofi Pasteur, making influenza a few years ago, proved that our technology is very rapid, very quick, very able at making vaccines.
That's very necessary nowadays. So lastly, what differentiates the company and why should investors really take a look at this company?
Well, I'm a bit biased, but my answer to that really is two parts. First part is we're great stewards of cash. You know, if you look at our cash burn, it's really negligible compared to any biotech trying to drive forward a platform. So that heritage I spoke about over the last 20 years of developing our platform for the industrial setting has really carried across our molecular biology toolbox into this world. So synthetic biology is very much part of our staple today. So we're great stewards of cash. We have no debt, no warrants, nothing sinister on our balance sheet. So we have cash. We also enter into non-dilutive FT-funded projects with big collaborators, big pharma companies and biotechs, both in human and in animal health. And so there's a big diversity there in terms of the applications of our platform. And we're agnostic to disease. If you have an oncology opportunity, we can express those genes of interest, or if you're a diabetic, or if you have another ailment, we can produce those sorts of proteins. And so I think that you can imagine Dyadic being interesting to stakeholders looking to watch our stock grow in terms of multiples. We're not just after one thing, we're after a real change in the ability of healthcare's cost to come down.
Wow, that's amazing. And thank you so much for being here with us today.
Thanks, Rebecca.
Of course. I'm Rebecca, and this has been Behind the Buzz.